This week, the House is actually voting to repeal the law in its entirety before it hurts Michigan families, workers, and job creators more than it already has. And it really has, because of the uncertainty, at the very least, that it's put into our economy. We've now voted over 30 times to defund, to dismantle, and repeal the law. Sadly, the Senate has not concurred in the bills that we've sent over to them and have chosen just to simply not react. In the state of Michigan, the law will stifle economic growth. As it's doing right now, it'll do more in hiring and raise health care costs for everyone. It would impose 21 new or higher taxes, 12 of which directly affect the middle class, unlike what the president has said, that it only goes after the higher incomes. This law would lead to a gross tax increase of almost $570 billion over 10 years. It'll cost $1.8 trillion over the next 10 years. For Michigan employers, the law will require those with 50 or more workers to provide government-approved health care insurance or pay a $2,000 fine per employee. This puts them in a real bind. Primarily, it will encourage them to reduce the hiring because of the uncertainty alongside of the increased costs that they would expect. That says to Michigan, less jobs, less employment, and the best way to have health care coverage is to be employed. That's a concern we have to address. Beyond that, we look at what this will do for Medicare. Medicare recipients right now are struggling to know for sure whether they're going to have payments. This health care reform bill took $500 billion away from Medicare to pay for the cost of the insurance. That doesn't look good for the future of Medicare or for those people expecting to receive it. The final thing I would point out is that the Independent Payment Advisory Board, a 15-member unelected panel, is still in place to decide whether or not insurance will cover you for your condition. Based upon your health, based upon your age, this panel will decide what type of coverage you get or whether you receive the care that you need at all. Looking at all of that, this proposal needs to be scrapped for a proposal that's patient-centered, private sector, in giving people choices, more competition, more opportunity for insurance at reduced cost because of that competition, more variety because of going across state lines to purchase insurance, less cost because of frivolous legal suits. All of that can be put in place and still keep the best health care available in the world, and that's the United States, available for us with reduced costs and more opportunities to choose. That's what I'll work for. And that's what will take place, I hope, as a result of what the American people decide in coming days.